I think meeting is being live streamed. Hello and welcome to the Public Health and Minority Health Disparities Subcommittee meeting. We are here today discussing House Bill 214, which had a public hearing last week. And we have some sponsor amendments that address a lot of the issues that were raised at the public hearing. So before we go into a discussion of the bill, I would love to have Aaron Hopwood talk about the sponsor amendments that everybody should have received in the email with the notice of this meeting, so that we're not talking about a bill without the sponsor amendments. So with that, I will pass it to Aaron Hopwood, and she could, and just so folks know sort of the process for these amendments, we took as much of the testimony as we got from the hearing as we tried to incorporate from all of the testimony we received at the hearing, some changes that would address the major themes. And we also tried to acknowledge sort of that the structure of the committee wasn't as specific as it needed to be to allow for all of the specific participation that was requested, with the understanding that we can't have a commission that is 28 or 35 members long. I think it was something like 35 if we added up everybody who wanted to be added on. So we needed to sort of rethink the structure, and as we mentioned in the hearing, sort of refine the scope of the work. So with that, I will have Aaron explain to us the bill as amended with the sponsor amendment, which then we would need to adopt, and then we can discuss it and further refine that amendment to make sure that everybody's needs are met. So that's the process I'm looking at. And so the committee members know we're not going to vote on this week. We can vote to adopt the sponsor amendment, and then we can discuss the bill with the sponsor amendment on it, and we would vote on that with any other further changes that need to be made at next week's subcommittee. Does that sound like a good process to committee members? I'm looking for nods and smiles. Okay, perfect. So with that, Aaron, can you talk to us about the bill with the sponsor amendment, should we choose to adopt it?
Okay, so you all have a reprint of the bill in front of you, hopefully. Beginning on page 3 of line 6 in line 5, this would strike the Healthcare Commission and HSCRC from membership, and they're going to be moved to a consult role. The amendments also add a representative of CRISP to the commission. And on line 10 for the local health officers, you go from 2 to 3, and then there would be representation from a rural, suburban, and urban jurisdiction. There are also the amendments would strike the members listed in lines 15 through 28 and replace that with 3 to 5 members of the public with demonstrated interest in public health and experience in at least one of the following areas: health equity, information technology, workforce, and population health. The bill then requires the commission to consult with the MHCC, HSCRC, and the Community Health Resources Commission and DBM. The amendments require the commission to establish specified work groups on funding, governance, and organizational capabilities, workforce, data and IT, and communication and public engagement. Each work group must contain 2 members of the commission and members of the public with relevant experience in the subject matter of the work group, including primary care clinicians, payers, consumer advocates, hospital executives, safety net healthcare providers, and public health clinicians. So with these amendments, there would be 13 to 15 members of the commission, and 4 state commissions and agencies would be on consult, and then 5 designated work groups that would contain additional public members. So that would be the alterations to the commission membership. Then there would be alterations to the assessment. So if you look on bill page 4 of 6, line 16, the amendments would strike the October 1st, 2024 due date for the assessment, and they alter the requirements of the assessment. So if you go to bill page 5 of 6, after line 6, there's new language that would require the commission, when conducting the assessment, to explain the impact of the public health capabilities on the state's ability to respond to COVID-19, overdose, maternal and infant mortality, and other major public health challenges as appropriate. The amendments would add to the specified recommendations from the assessment to include recommendations on communication and public engagement. So now the recommendations would mirror the work groups that are established by the commission. And then on bill page 6 of 6, after line 15, there would now be a requirement for an interim report that would be due December 1st, 2023, And the final report would now be due October 1st, 2024, instead of October 1st, 2025. And that was in response to some of the testimony we heard about moving up the timelines for the commission. So that is it for the sponsor amendments.
Thank you, Erin. So what I would like to do is open up to members any questions they have about the sponsor amendments. Do we have any questions about what Erin just walked us through, or did it make sense to folks? I have a question from Delegate Hutchinson. Go ahead.
Thank you, Chair. A question, just I don't know if this is appropriate to ask, but is there a reason why MHCC wants to be off of the commission and only in a consultative role?
So I think it was more a factor of figuring out how we can accommodate all the folks who wanted to be on in a way that works best for them. So this puts, and Erin can back me up here, but we're putting all of those extra state agencies in the consultation role just to keep the size of the commission down. Erin, do you want to add anything with that?
And the MHCC
share their expertise. Go ahead, Erin.
Yeah, they did not ask to be removed. It was, like Delegate Kelly said, kind of the idea that the agencies could be contacted when the commission was looking at issues within their areas of expertise. So that is when they could weigh in.
That actually answers it, that they did not ask. We took them off. Thank you.
Yeah, and it wasn't for any reason other than if we were to include every stakeholder that wanted to be included, we would have 35 to 40 members. That's what came in at the hearing. I added them all up. I just found my memo. 35 to 40 members, which is too much for a functional commission. So we have had commissions that have this style structure in the past, where you have sort of the main commission, and then you have the work groups that have extra members, and you have the advisory members, so that you have a more manageable commission size, but you still have the resources that you need. That's how the Healthcare Workforce Commission is structured. I'm trying to see the order of, does that answer your question, Delegate Hutchinson? Kind of.
Yes, that answers it. Thank you.
Sure. So I think next was Delegate Lopez and then Delegate Lewis. Go ahead, Delegate Lopez.
Sure. Thank you, Chair. You kind of alluded to the answer of the question I was asking. I'm new to the committee, so I have kind of a foundational question, and that is there or are there commissions that are somewhat analogous in their structure or composition that I can kind of look to figure out how this is put together? But that's something I could follow up with you offline, because you alluded to the fact that there are. So
yeah, it's similar to how the Healthcare Commission is structured. And I believe Delegate Bagnall, the Oral Health Task Force, worked like this as well. Yeah.
That's correct. We had a task force that was designated, but then they created work groups within that task force so that the work could continue in the interim between meetings.
And I know with the Healthcare Workforce Commission, the reason we did this was because we had this really expedited timeline, which is similar with this commission as well. Delegate Lewis. Delegate Lewis, did you have a question?
There we go. Thank you, Madam Chair. I was looking for my unmute button. Thank you. I'm really glad to be part of this work session, and so glad we're doing this bill. My question is about the importance of oversight on the procurement process during a public health emergency. And those of us who lived through the COVID-19 emergency and what we observed regarding procurement of ventilators, COVID test kits, and other matters was concerning. So I'm looking to this bill for structures or procedures or recommendations, attention, so that we avoid those sorts of problems in the future. And as I read the bill, I see that there's a mention of procurement, there's a set of recommendations about procurement that will be made, but I wasn't so sure that I saw where procurement sits in the foundational health services. So I appreciate a little more clarity there. Thank you.
And let me suggest, Delegate Lewis, that's a great question for part of the larger conversation. What I would like to do is just focus on sort of the structure of the amendments, what the amendments actually do so that we can adopt the amendments and then have a conversation about whether we need to refine the bill as amended. If, it sounds like you might have a suggestion for how we could be more robust in the procurement space, which would be appropriate to discuss after we've adopted the amendments so that we're working from the new structure, if that's okay. Yep. Okay, I think Delegate, Rosenberg, then Hill, then Chisholm, right? Let's go to Delegate Rosenberg.
Thank you, Madam Chair. My question, or more of a comment, really has to do with the language on page 5 of the original bill regarding the commission's explaining the impact of the public health capabilities on our ability to respond to certain issues, traumas, events. The 3 or 4 that are listed are mandatory. They shall do that, but they may do others as well. Is that correct?
I'm sorry. What line are you looking at? And is it part of the language that's struck in the amendment?
No, it's new. It's new language. Page 5 of 6 of the original bill.
Okay, and conducting the assessment.
Yeah, between the lines.
COVID-19, maternal infant mortality, and other major public health challenges as appropriate. So your question is about the other.
Right, that's a may, whereas the others are a shall. The ones that preceded are a shall.
Yeah, he's correct.
And Aaron, if you want to answer that, I think the general answer is we're trying to be a little bit more narrow. Is that?
Yeah, no, he's correct. So they have to explain the capabilities to respond to COVID-19, overdose, and maternal and infant, and then the other challenges would be determined by the commission.
And I think that the thinking behind that is that if you notice that we got a lot of feedback that people wanted expedited timeline here. So we don't want to have requirements that are too broad, but we want to have a little bit of flexibility. I don't know if Dr. Sharfstein, did you want to add anything to that? No.
Could the COVID, a suggestion, whether the COVID-19 language could be to end or other pandemics? Because I mean, we're looking to the future. I don't know.
I agree. This is a good conversation, Delegate Rosenberg. But again, I'm going to ask the committee that we adopt the amendments before we move into discussing how to refine it. So I'm going to put a pin in the procurement question from Delegate Lewis and the specifically other pandemics language possibility from Delegate Rosenberg. Okay. And the next question is Delegate Hill, then Delegate Chisholm. Go ahead, Delegate Hill.
Thank you, Madam Chair. Actually, Delegate Chisholm was ahead, but I was going
I'm sorry.
I was going to just move the amendment. So I don't know if he wants to.
I love you. Let's hear from Delegate Chisholm first. Someone want to second them, and then Delegate Chisholm can have his question.
Second.
Go ahead. Second amendment.
Okay. Did you have a comment, Delegate Chisholm, or a clarifying question on the amendments?
Now that they've been moved and I guess we passed the amendment.
We haven't voted on them yet. They're waiting to be. Shall we vote on them and then we can talk?
Well, I guess my question is on, and I'm going to stay on what Delegate Rosenberg, and that's what my original question was. It's kind of vague to me. Are we now going to go back and look at how we handled COVID-19 and all of the impacts as far as like the shutdowns and how it just seems like it's a very broad amendment that they're going to be looking at so many things, and how directive is it going to be?
Right. And so I appreciate this conversation and we need to have it. So I want to get to the place where we're having it with the language of the amendment, with the stakeholder changes and all of that. So once we adopt this, then we can have that conversation. It'll be robust. So we have 2 weeks to have it. Sound good, Delegate Chisholm? Okay.
Yes.
So let's vote on the amendment and then we'll hear from Senator Lamb. Is that okay with you, Senator Lamb? Okay. So is everybody, amendments have been moved and seconded, all in favor of adopting the sponsor amendments so that we can continue this robust conversation about how to tweak and refine it? Say aye.
Aye.
Aye. Anyone opposed to the sponsor amendment? Okay, so they are adopted. We will hear from Delegate Lewis. We will hear from Delegate Rosenberg. First, I'm going to go to, and we'll hear again from Delegate Chisholm. But first, I'm going to go to Senator Lamb because he has the cross file of this bill in the Senate, and we would like to hear from him since now we've adopted all these amendments and changes. Obviously, it's really important to hear from you, Senator Lamb. What can we do? How would you like to weigh in on the amended language we have here?
Yeah, so that's helpful. So I guess I've been giving some more thought to the structure of the commission and the fact that the amendments that were just adopted have a series of work groups that were attached to them. I guess, and you and I talked about this a little bit just yesterday, that I have some hesitation with work groups because we have been hearkening back to the work groups that we've had last year, I guess, in the Healthcare Workforce Commission, where
Can
the
I
work.
put a pause on you for 1 second? I want to hear everything you're saying, but I forgot something I was going to say at the top of the meeting, and I think it's related to what you're going to say. So this is for all members. We're not going to pass a commission with more than 20 members. So right now, the original proposal had 18 members. The amendments would have had 35 to 40 members. As we discussed what we want the structure to look like, if we want work groups or not, and that whole, and what the scope of the work they're doing should do. Just keep in mind that if you're suggesting we add members, you got to tell me who we're taking off because that's how we have to do this. Also, Senator Lamb, the other thing I was going to say at the top of the meeting was what I would like to do after we hear from everything you're going to say with the members of the House Committee. First, we're going to discuss one, do we want a commission at all? Hopefully we can reach an agreement on that today. Two, what do we want the scope and timeline of that commission to be? What should the assessment be looking at and things like that? Because that is, I think, something people really want to discuss. And then three, who should the stakeholders be who are part of that conversation? So we'll break it up into 3 chunks so that we can have the appropriate order, right? So that we know we want to do it, and then we know what we want it to do, and then we're talking about who's on it. So with that, and I'm sorry, Senator Lamb, I should have said that at the top of the meeting, but I think you joined us late anyway, so I would have had to refresh everyone. Back to you, Senator Lamb.
Yeah, sure. And thank you for that kind of preface. And fully recognizing I'm an interloper in this House hearing, subcommittee hearing here, but we're hoping to be able to kind of align things when they come over so that we can minimize the, kind of work through when it comes over here to the Senate. But, back to what I was saying, I hearken back to the Healthcare Workforce Commission that has been meeting over the last year, and it had a series of work groups and also a very broad charge. And one of the challenges that we've seen, and even reviewing the interim report of that work group, is that it became very unwieldy, I think, with so many work groups involved. It was either, and if you look at the interim recommendations from that, part of it was to narrow the scope or to be able to kind of bring the pieces back together. And I think that's one of the challenges of having several large work groups spun off of that commission with a very broad scope. And I'm just concerned that this is going down the same direction of where we can either maybe look at narrowing the scope a little bit, or I'm just not sure about these work groups. And so, wanted to posit that to the subcommittee just as a thought. I am in agreement that we don't want a commission that's too large or too unwieldy, because I think it can be really difficult to work with. But I think we need to be very thoughtful then as to who is going to be on this work group as well. There's going to be opportunity for people to provide public input, just like any other public commission. But I think, if you have too many people on the work group, it's going to be very difficult with a large charge to be able to come up with concrete recommendations. My second part has to do with the foundational elements, I think under 13-4801C1, where there's some foundational areas that are stated up front at the beginning of the bill. My suggestion there is to add behavioral health, because it's obviously a really important part of what the health department does, and there are a lot of needs there and also a lot of challenges. And so I think that was missing, probably just an oversight of some sort at the beginning there to have that included. And then when it comes to the membership, maybe adding a diversity clause that the appointments that are made by the governor should reflect the geographic, racial, gender, and diversity of the state. That may also help with ameliorating some of the concerns about different stakeholders trying to weigh in on this too. I'll stop there and let you all continue to talk about that, but just wanted to put some thoughts out there on that.
So let me just make sure I got, and I hope Aaron Hopwood also took note. So diversity clause, adding behavioral health, and of course, either narrow the scope or figure out a way that this work group model works more efficiently than maybe the Healthcare Workforce Commission did, so that the interim report is a productive report. That's the main goal I'm hearing from you. Is that
right?
Accurate
and
reflecting?
Right, that's correct. And also listening to the hearing from last week on this bill, there were a lot of folks coming in, obviously, to ask to be included on the commission. I'm just not sure everyone needs to be on that commission, and I think this is where the scope maybe having some mission creep, and that's why so many folks are wanting to be on board with this. And so, just kind of rethinking that and giving that some careful thought.
And just a follow-up question to you, Senator Lamb, because we do want, we want to get it out of the Senate. That's important too. If you were narrowing the scope, what would that look like in your mind? More focus? Do you have specific thoughts there?
I want to take a look again at the amendments that were just adopted. I can get back to you on that.
Okay, super. And we'll be discussing this next week, but I suspect the conversation of the scope of what the commission is doing is what we're about to head into. So I think I should go back to the colleagues that I put on hold until this conversation, which I believe in order was Delegate Lewis, Delegate Rosenberg, Delegate Chisholm. So Delegate Lewis, questions on procurement and how this commission might address procurement related issues?
Yes, ma'am. Yes, ma'am. So I think it might require nothing more than including procurement in the foundational capabilities, which is on page 2 of 6 of the amended version. And there's several foundational capabilities listed here. So, yeah, we've got emergency preparedness and response, but I think we should be more explicit. So perhaps there, Erin, you can help us think about that.
So it's my understanding that organizational competencies includes procurement, but you could just say, and you could add a comma, including procurement.
That could do it. I just think it's helpful to be explicit about it. And then I guess so that's the foundational, and I guess the other part of that bookend would be, okay, on page 5 of 6, line 15, based on the assessment conducted, the commission shall make recommendations for reform in procurement's already there. That might be enough. That might do it.
Excellent. Good problem solving. Thank you, Delegate Lewis and Erin. I forgot to do the thing I wanted to do most, which is take a soft count on the committee. Are there any members of the subcommittee who don't think we should move forward with a commission bill of any kind? Is there anybody who wants to make the argument this is not a good use of our time? If so, we can have that conversation, but I don't see any hands up. So I'm going to go ahead and assume that the committee agrees that we want to move forward with this, and we're going to just talk about the scope and the membership. Perfect. Okay, so that brings us back to Delegate Rosenberg, who wanted to talk about the COVID language, right?
Yes. My recommendation just is that it should be in some way, shape, or form refer to COVID and other potential pandemics, because from what I've read as a layperson, there's a real possibility, likelihood even, of other pandemics. I just think that could be a little broader, but I defer to the real experts such as Dr. Sharfstein.
Well, let's hear from Dr. Sharfstein. What do you think about that? Would that hamper this, or is there flexibility in that language?
So thank you. And it's just so great to hear the subcommittee talk about this topic in general. Just to say that the purpose, I think, of this language is actually to narrow it somewhat. And this is also a response to Delegate Chisholm's point. So the previous language raised the question of whether this was going to be like a rehash of COVID. And the idea, I think, behind this language is to say that the commission should be able to explain its assessment of the foundational capabilities and its impact. So it would basically be using examples from COVID, from overdose, from maternal infant mortality of what it found in the assessment. And then that last language for other things just gives the commission the flexibility to say, well, if there was, like to Delegate Lewis's point, if there's a procurement problem, here's how it manifested itself. Here's how it might, manifest itself, and give some flexibility. So to specifically Delegate Rosenberg's point, I think you could include other infectious diseases, for example, or other potential pandemics, but it certainly would be included in the final phrase too. So to the extent that the capabilities have an impact on something that's really important for people in Maryland, the idea is to explain that. it's not oriented toward, this isn't a report on preparing for the next pandemic entirely, or on a rehash of the, COVID pandemic. It's more using examples to illustrate the points about the foundational capabilities. I hope that makes sense.
So the examples would come from the recent past, which is COVID-19 at this point.
Right, exactly. If there's just to take Delegate Lewis's example, if it's about procurement, and here, let's say there's some challenge giving contracts or something through procurement, and this is how that might manifest itself. It's made it hard for Garrett County to, address a program on hypertension. It's made it hard for this other county, so it's really tangible. So people can see the connection between the foundational capabilities, which is a little abstract, to the actual problems that, Marylanders experience.
So let me go to Delegate Chisholm, because I think this is part of your question as well, and or comments. And I know we have a number of stakeholders here. I wanted the committee members to have the opportunity to ask questions about the language, but now that we're moving into the conversation, as appropriate, we'll bring in all the stakeholders, not just Dr. Sharfstein, because I see you all there as well. Delegate Chisholm, and then we'll go to Delegate Bagnall.
Thank you, Madam Chair. And I appreciate the impetus of the bill. It's so broad to me that, and I understand, look, it's going to be a look back with the intent that we're going to go forward and try to make recommendations, to make adjustments, and put things in place now to avoid some of the mistakes in the past. I guess, and to Delegate Robin Lewis's point, look, I was appalled last year when we had that audit of emergency procurements, which showed basically almost $1 billion in mistakes. So my question for you, Madam Chair, really is it going to have any teeth? Or are we just creating something else again that's going to look at and say, look, here's all the problems, but we don't correct any of the problems? With that audit last year, that was my question. All right, we just wasted almost $1 billion in taxpayers' money, but we did nothing. Are we going to put all these commissions together, and considering how many stakeholders and how many people are on these commissions, is it going to be used in a positive way with real changes that on a broad scope we all appreciate and agree with? Or is it going to be 8 health officers that say, hey, we think this is right, and we're going to kind of force it down the public's throat?
That's actually a really great question, Delegate Chisholm. And I think, I don't want to speak for the whole subcommittee, but I can speak for myself. I think the goal for this bill is to do something very specific and concrete that we can get the investment in of all of the appropriate stakeholders, right? So that we can move something forward. And that's the point of the recommendations, right? Of this subsection shall include the funding or legislation required to implement this recommendation, if any. I think it sounds like you have sort of 2 parts to your question. One is sort of, are we going to get a tangible work product from this commission that is going to inform our policymaking? And the second part is, who are the folks who are going to be at the table developing that, so that we can be sure it's something that we can all get behind? Is that about right?
That is 100% correct.
Okay, so let's focus on making sure we can accomplish both of those goals, because I think we share those goals. I think that the answer to both of those questions lies in the details of defining the scope and the deliverables of the commission, making sure that timeline is going to work because it is robust, making sure we have buy-in from the stakeholders who are going to be part of this commission, making sure that everybody, every voice that wants to be included has a space within the work product and process to be heard. And that's the thing that's going to make it most likely that we result in a work product that we can then implement as legislators and move forward in a productive way. So that's the best answer I have for that. But hopefully we will succeed. I think we share that goal. So let's refine the language as needed as a result of these conversations to make sure we're getting there. Delegate Bagnall.
Thank you, Madam Chair. And I think mine is actually a follow-on to Delegate Lewis and Delegate Chisholm. In looking at the sort of foundational language, I think it's implied, but it's not implicit. We don't actually mention accountability. I mean, we don't mention oversight. We mention accountability and we mention performance management but those tend to be more reactive, whereas oversight is a little more proactive, looking at, you know, who is responsible for that? Because I know even during COVID, that understanding was a little bit squishy in terms of whether it was the department, whether it was the administration, whether it was the General Assembly, and maybe just adding that as a foundational look to the oversight arm would make us would give us some proactive work product.
So that is a potential suggestion in the list of the following foundational capabilities.
Yes.
Aaron,
Just
thoughts?
Can I just
consideration.
chime in here on the foundational capabilities? These this is a national definition. So it might be best to, instead of tinkering with the foundational public health services, really focus on the recommendations that'll come out of the commission.
That's
So
smart.
it could be recommendations for oversight, if that's, and recommendations regarding procurement, instead of altering that foundational public health services.
Where in the reprint would that be, Aaron, my friend?
Which one? The recommendations?
Yeah,
or
where
the
you're suggesting it would be.
recommendations would be on bill page 5 of 6 in line 15. And that's where you have organization, IT, workforce, procurement, funding.
Mhm.
So you could add oversight language there.
Okay. How did committee members feel about that? We're gonna come back next week with some tweaks. So we already have, is the recommendation the same then, Aaron, for Delegate Lewis's suggestion? So
I
that
think
we
it would
can
be
come back
best, instead of starting to tinker with that foundational language, then you're getting the same goal, because your recommendations will be to those points.
Yeah, I think that's a great idea. Okay, so we'll come back with something in that space. I don't see any more hands up from members of the committee. I would love to, Delegate Hill. Go ahead, Delegate Hill.
Thank you, Madam Chair. A couple of points, if it's appropriate this time.
Of course.
There's nothing in this bill that requires that the commission at any time have any kind of public hearing. And that may be deliberate, but when we're talking about public health and rebuilding trust and communications, it just seems that if we don't want that, I just want to confirm that that's a deliberate choice not to require them to have a public meeting.
Well phrased question, Delegate Hill. I don't think any of us want to say that. So
I mean, I know they can give input once the reports come out, but particularly when there's a look back on COVID, to not require, again, any kind of public meetings in districts or anything like that, I think may be an oversight. And I know that some of the testimony we had spoke to having more consumer representation, which the amendment doesn't do. And again, the 20 member.
I think it creates the work groups and it has the consumer participation on that, but it's a different structure than they were looking for.
Right.
But that's the structure that brought us to 35 to 40 members. So,
Right, exactly. So again, absent that,
right.
I'm just asking the subcommittee to consider whether we would like.
So maybe we
some
should talk about the timeline and what we're expecting from this commission and see if there's a way we can fold in that public meeting component as well. Does the committee feel good about moving down that road conversationally? Okay. So Aaron, can you talk to us about sort of what the bill as amended, what the timelines are? It seems really aggressive to me. I know the stakeholders who asked for a speeded up timeline believe it's doable, but having been around a while, I don't want to put too much pressure on such an expedited report, but I think Delegate Hill's point is very well taken. So we need to figure out how to balance that interest. So Aaron, walk us through what the timelines are again in this proposal before us.
And so the interim report would be due December of this year. So you'd have to get the commission appointed, up and going meeting, have an interim report, which an interim report is fine. They could just say, here's what we've done so far. The final report due October 1, 2024. The bill as introduced had language, if you look on page 5 of 6, that the commission would have 3 public meetings in different areas of the state for an opportunity for public comment. I think you could put that back in.
Yeah. And that would just not necessarily happen before the interim.
Yeah, there's not, because the bill as introduced required this on or before October 1, 2024. And you've kind of, and that was for the assessment. You added actually more time to it. So I think that would be feasible.
Excellent. Delegate Hill, would that meet your needs? I love it. Thank you. Way to go, team. There's a lot of stakeholders here at this meeting who we haven't heard from yet. And I know, I don't even know what order to go in. We have heard from Dr. Sharfstein. We have not heard from Larry Polsky yet. So how'd we do meeting your needs, Dr. Polsky, and then we'll hear from Ben Steffen.
I'd like to thank the committee for considering everything that we said and I think really meeting our concerns, our needs. The only comment that I would make at this point, and I don't want to open up a can of worms, but on page 5, the section that has already been referenced in new language, which would be, I guess, now line 6, B1, where it states what has to be addressed in the report, the shalls. Environmental health, I think, is something that is of critical need. And we hear that when we take a look at bills that come across the legislature each year, environmental health is right up there in terms of deficiencies or where we could do better in public health. So I would just throw that in as a possibility under the shall category. It is mentioned as a foundational area earlier in the document. It would just be nice to see that carried over into that subsection.
Okay. I don't know if we want to talk about this or if we want to hear. Let's hear from all the stakeholders first, and then we'll make a list. Mr. Steffen, Ben Steffen. Hi. How'd we do? You're muted, Ben.
Thank you, Chair Kelly, members of the subcommittee. So in thinking about this, I'll just have a brief preamble. I saw this as a broad policy commission, not focused on implementation, almost where do we carry public health forward into the future, recognizing that, as Dr. Sharfstein said, there's going to be a lot of lessons learned from the last 3 years, but this is really not a quasi 9/11, commission to look at what worked and what didn't work and why things were the way they were. But and that would still be my recommendation, to think of this broadly as a policy commission. And I think some of the stakeholders that are seeking participation could step back. The Healthcare Commission doesn't have a strong position. We can serve on the commission. We can support the commission. It's the elected leaders' decision here. What I would say, given my view of this as a policy commission, you ought not probably put the state designated HIE CRISP on this policy commission, if you will. They receive about 65 or 70% of their funding through government arrangements, both with Maryland and the District of Columbia. And I think while they're extremely valuable, no doubt about it, and we are working with them currently in really articulating what a public health data utility looks like for the future, not only in Maryland, but across the country. I think it would be a mistake to put an organization, a non-government organization, on this policy commission. They obviously need to be brought in to provide their input, recommendations. A host of data systems were developed under CRISP direction, and that insight is going to be valuable for this broader assessment moving forward. I'll leave you with this last statement. 4 years ago, if we had a meeting on public health, 3 people and a card table would have been sufficient. The fact that public health has been elevated, I think it's a great sign, and I commend the committee for their work. So thank you.
So is your suggestion, Ben, in summary, to move CRISP to the consult as necessary section?
That's correct. That's
Okay,
correct.
thank you. Sorry, getting lots of messages here. Okay, who else do we need to, Megan, do you have anything to add from HSCRC? No, maybe?
No, I just joined because we were moving around in the bill, and so I wanted to listen in on the conversation. But I think we're fine with where we've landed. We think this is an important process and project, and I have found in other work that I've done that when the state agencies are able to work together, we're very effective, and I think this accomplishes that. So I think I have no problems with the bill as it is. I think it's great.
Excellent. Thank you. Dr. Chan, hello, welcome.
Hi, good morning. Is it still morning?
Barely.
Good morning, Chair Kelly and members of the committee. Thank you so much for your work on this bill. So I've been looking at it with great interest when it first appeared in the news, and then of course when the bill dropped. And I really appreciate the feedback and some of the modifications made of the amendments today. So that's one. I think that I agree with, in listening to all the feedback and discussion, agree with the members that a focused approach to this, especially given the shorter time frame, will be very, very helpful to make sure that we come out of this with very tangible, specific recommendations. And I appreciate Dr. Sharfstein's comments that and others, that this is not to relitigate everything that was done during COVID or during the opioid response, which all of this is ongoing, but to take lessons learned so that we can carry it forward to strengthen public health. And I would say that, that's our top goal is, how we take those lessons learned and resources to strengthen where we are. In terms of the advisory committee, I do also agree with my colleague Ben Steffen on moving Chris over to an advisory role. I would perhaps just to, as a catch-all, perhaps suggest saying and other state agencies as deemed appropriate to consult with. We had suggested perhaps do it, IT, yes, because that's a really key piece, and we have been working very closely with them, but they don't, we don't need to name every state agency. So that's one suggestion. And then the other, in terms of the work groups, and I hear Senator Lamb, I don't know if he's still on the line, but
he is, yeah.
Okay, and I can't always see on Zoom, but I think that having some the composition outlined is helpful. My only suggestion would be perhaps instead of public health clinicians to change it to public health practitioners, because what we need is not necessarily a focus on the healthcare aspect of health, but really public health is much broader than healthcare delivery. So what I would be suggesting is public health practitioners who actually are out in the field or have extensive experience actually implementing public health practices.
Excellent, Dr. Chan, that's super helpful. So I heard from you, CRISP to advisory, other state agencies language, so that we can be sure to include do it and anyone else who might come up as necessary, clinicians to practitioners, right?
Yes, ma'am. Yes.
Okay, Erin, you got it? I see her nodding. Thank you. Very, very helpful. Do we have any questions from members of the committee? As we have stakeholders talking, feel free to raise your hand and I'll call on you. We have one from Delegate Hill. Go ahead.
Thank you. And I think this may, I was off for a second. This may dovetail nicely with Dr. Chan was talking about. I don't know if this is the group or not, this commission, but one of the things that I think we do have missing is a real assessment of Maryland response to the Medical Reserve Corps and what works well and what doesn't. And if this is the appropriate place, then my question is that implicit in the language that when we talk about all these functional areas, that would also be studied, or would it be important to list somewhere in here that Medical Reserve Corps, its functionality, and whether it does all the things that we anticipate that we needed to do, whether that should be looked at.
That's a great point to be raised, because I agree with you completely. I'm not sure we need to be that prescriptive in the language. Erin, do you think that that's implied there, or do you think we need to write that in?
So I think if you want to be sure, then, and like I was saying before with the recommendation, so if you go
Yeah, we
back to
could
the
put it
medical
in there.
reserve corps, that you would just add that.
Okay.
And if there's no recommendation, there's no recommendation. You could say if any, or something like that.
I think that's a great suggestion. Any other members of the committee want to weigh in on that? Otherwise, we'll add that to our omnibus amendment list that we're working on. I hear no opposition, so great contribution, Delegate Hill. I'm looking to stakeholders. Do we have any other stakeholders want to raise their hand who want to weigh in on this? I'm looking for hands. I see no hands. Did we make everybody happy? Is that where we're at? There we go. Delegate Chisholm.
I'm not a stakeholder, so I was waiting.
Oh, no, it's your time. It's your moment to shine. Let's talk.
So there were some suggestions on different people to be added. Are we going to talk about those before? Like, I'll be honest with you, adding environmental health would probably be, unless we made some major changes, I would not be for the bill because I think it's way too broad and you're not going to get a consensus on some environmental health issues. And what I don't want is this to be quite frank with you, to be a scapegoat for people that didn't or may not want to take accountability. What I mean by that is during COVID-19, I had a lot of constituents yelling at me, and I'm sure all of you did too, to do something, but I couldn't figure out who was making the decision. And what I don't want is big decisions being made in this commission and then being able to hide behind the blanket of the commission.
So we did hear the suggestion of adding environmental health from Dr. Polsky, but I also heard him say that was not the hill he was going to die on. So do we want to hear from other members of the committee on that idea? Or if we're hearing from Delegate Chisholm, that this is going to be a problem for him? I know that, that I think the committee would prefer we have strong support and we come up with a work product that everybody's comfortable with. It sounds like we're very close. Any other members of the committee want to fight to keep environmental health, the suggestion of adding that in, or should we save that for a separate bill? Acknowledging that it's listed in the foundational areas already. I hear silence and crickets. We can bring it up again next week, but I don't think we're going to put that in the amendments that we're working on. If someone wants to bring it as a standalone amendment, we could discuss it next week. But out of respect for Delegate Chisholm raising it now, I think you make a good point, and you've consistently expressed a desire to keep this narrow and focused. So I think that's probably best for this vehicle we're working on right now.
Madam Chair.
I don't see who it is, but I'm calling on you.
It's Delegate Hutchinson. I do have my hand
Perfect.
raised, but that's
Oh,
okay.
really? My screen is problematic. Go ahead, Delegate Hutchinson.
That's okay. I also concur with Delegate Chisholm's thoughts too around environmental as well. So I would not want to move forward with that under this discussion today.
Okay, perfect. Well noted. And we will not put that in the amendments that are coming from the sponsor next week. If a member wants to do that, we can have a conversation on it, but we don't want to tank this really important bill because of something that's going to be controversial when we have reached an agreement so far. So I noted, and I appreciate, there you are. You just showed up on my screen. I think we're having some internet problems here in the office. Okay. So are there any stakeholders that haven't weighed in on their thoughts in terms of the direction we're going with this bill that need to be heard? I'm looking for hands, noting that I didn't see Delegate Hutchinson. So I think my scanning capabilities aren't as good as they once were. I don't see anybody raising their hand. So with that in mind, I think we're in a good place, and I will just summarize where we're at. We adopted the original set of amendments. We had a conversation where we all agreed we want to move forward with something. We discussed the importance of keeping it narrow and specific to meet the timelines, the folding back in some public accountability, very important. I didn't hear anybody opposed to the idea that was raised about moving CRISP back to advisory. There seemed to be consensus that that is a good place for them. Is anyone concerned about that? Don't hear any concerns, so that's a good sign. Dr. Chan had the suggestion of clinicians to practitioners. I didn't hear anybody concerned about that as well. We addressed making a specific recommendation of the Medical Reserve Corps. I bet Erin has more things on her list. So maybe we want to discuss the diversity clause issue that Senator Lamb mentioned. I do know that that was a real concern for a lot of the stakeholders. There's sort of boilerplate language we could add to this, right, Erin?
Yes, correct. I can definitely add that.
Okay, and we've put that in other missions. Okay, good. So let's go ahead and add that in as well. The behavioral health as a foundational area issue. You were saying, Erin, that those are from a national. We might not want to tweak that there.
Yeah, I think the best option to address issues is to not go into that foundational public health, but
so
in
Senator
another
Lamb,
way,
is there another place
sure.
we could make sure to incorporate behavioral health?
Yeah, and we'll just figure out how to do that and where.
We'll look back with Senator Lamb. Looks like he's multitasking. Oh, there you are. Hi, Senator Lamb. We were just discussing coming back with amendments next week. Everyone seemed okay with the diversity clause language suggestion, but in terms of the behavioral health, I guess the foundational areas are from a national language, and we're wondering if there's somewhere else we could put that reference to behavioral health in that would make you comfortable, maybe in the recommendations area. I'm just tossing out ideas. Do you have any ideas? If we didn't want to mess with that list at the top, the foundational areas list, because that is, Erin, help me out. It's a national, Dr. Sharfstein, go for it.
Sure. I was just going to say that there is a national effort. It reflects several years of thinking about public health, but behavioral health is really obviously critically important, and I think most people would fit it under the chronic illness part of the foundational areas. So, I mean, one option might be just to do that including concept that Erin said before. I mean, obviously, there's nothing that stops you from adding one. But I'll put the website in the chat. And when the other states have gone and done a similar exercise on public health, they've followed this framework. So this, by referencing this framework, it allows Maryland to be doing something similar. But I don't think people would, say that it's exclusive of behavioral health. So you could just be more explicit about that.
So we could potentially explicitly say chronic disease, including behavioral health and injury prevention, something like that. Okay, Delegate Hill.
Thank you. So again, dealing with this issue, I heard a couple things. One, Dr. Sharfstein said throwing it in there may not be as problematic as Erin thinks it might, although sticking with national models is fine. It might also be leading the national model to make sure it's included. But yes, behavioral health does fall under chronic disease. It could fall under injury prevention, right? Because it's a form of injury, but it's also clearly, when we're talking about, in this context, particularly when we're looking back at COVID-19 and any other pandemic, it's also an acute disease. So I'm a little bit leery about categorizing behavioral health purely as chronic disease and injury prevention, including behavioral health or something like that. But I'm not sure I'm comfortable with just.
I kind of had that feeling too, Terry, Dr. Hill, Delegate Hill, I noted that as well. So if nobody is so Dr. Sharfstein shared with us the link to the national list. Dr. Sharfstein and or others on this call, is anyone going to be deeply offended if we add behavioral health and slightly stray from that foundational areas? Because I think to Senator Lamb's point, this has been a huge priority for us and we want to lead in that space and acknowledge it. I see nobody saying we should not. Dr. Polsky, go ahead.
I wouldn't get caught up in what should be a continually updating list from a national organization is. And I would say, since we seem to all agree that this is truly fundamental right now, that specifically listing it would be appropriate in this context. And I don't think we're opening up to, a huge laundry list. This is something that impacts, and we can take a look at almost everything else on that list and how behavioral health directly or indirectly is a factor there.
Perfect. Thank you for that. And it looks like I see a lot of heads nodding as you're speaking. So Erin, let's go ahead in the amendments for next week and add behavioral health in under the foundational areas. And hopefully that will address some of Senator Lamb's concerns. 11:58, you guys, we did great. Is Senator Lamb still on? I think he might have hopped off, but I feel like we addressed it. Are you still on? Okay, so we're going to adjourn our meeting in 2 minutes and we will reconvene next week with these amendments. Do you feel like, I know we didn't talk as much as we would have liked to about who the members are and what that's going to look like. Although we did hear some feedback from Dr. Chan about the work group model being a good one for this. And we heard from about the advisory role and that. So I know that conversation, we still need a little more conversation on for next week. So we will bring that back next week along with all the rest of these amendments. We do hope to vote this bill out next week. So if you're coming with recommendations to changes of the structure as we amended it today, be real specific because we'll have to do those amendments in the subcommittee and discuss and consider those. So specific proposals, not vague concepts, would be really welcomed next week as we finally finish hashing this out. But I feel like we did a really good job today. Go team. I'm very proud of the subcommittee and all of the stakeholders for weighing in. Thank you all for your contributions to this very important bill. And we'll see you in full committee at 1 o'clock.